Okay. Well, fantastic to make this happen. Thank you, Sophia. Thank you, Nicholas, for joining. And so this is going to be an informal conversation. Just to get the conversation going, I'm going to tease you a little bit for a sentence that the CEO of Johnson & Johnson said just recently. And he said something like, there's going to be more change in healthcare in the next 10 years than what we were able to observe in the last 100 years. And this change is primarily driven not just by the science that is growing at the exponential pace, but also what digital, what technology, what data can do for healthcare. But let me ask you, first of all, if you don't mind to introduce yourselves before you speak, but do you agree with the sentence that we're seeing more change in healthcare in the near future than we've seen in the last 100 years?
Oh, well.
But Sophia?
Okay, so I'm Sophia Cote da Rocha. I'm very happy to be here. Congratulations on the organization of tomorrow. I think it's always great to think about tomorrow today, because it's today where we need to build it. So I'm a medical doctor by training and a designer by training too. And now I'm leading digital transformation and innovation in Lusíadas Group. So it's been a challenge to mix everything that's relating to innovation and technology to healthcare. A very conservatory department in innovation. But regarding your question, just a very quick answer. I think it's actually quite in a conservatory way to think about 100 years. I think in the next 10 years, actually, we are going to move much more than that, because we are in the Middle Ages in healthcare in terms of concept. So we have a house where we put people that is not that okay. So it's the same as it is for the last 700 years, more or less. So I think in the next 10 years, we're going to move people that are sick from the hospital to the houses, which is actually a huge change.
Fantastic. Nicholas, can you present yourself, but also get into the question?
Yes, absolutely. So good morning, everyone. I'm very happy to be here, and thank you very much, Nuno, for inviting me to join this panel today. My name is Nicholas. I'm heading at CSLV for a team named Strategic Insights and Analytics. And for those of you not familiarized with CSLV4, so CSLV4 is a pharmaceutical company. We are a leading pharmaceutical company in iron deficiency and nephrology, and we belong to the CSL group, which is one of the leading biotech companies in the globe. Now to your question, Nuno, I can reflect a little bit on the priorities of commercial excellence today. And actually, our priorities is not only, to bring new products to the market, which was always the priority of a commercial group. It is also to ensure sustainable growth, and it's also to improve customer experience. Now, how you get there is not that easy, as you were alluding to in your introduction. So we have defined a number of initiatives that move from, capturing better customer insights, improving omnichannel analytics and operations, down to commercial effectiveness analytics, so really down also to the sales rep. And all of that, will be then supported from an analytics standpoint by a commercial analytics center of excellence that we are building together with the colleagues from BA for All. So to your question, yes, it's a lot of change, a lot of adoption of innovation, digital, and new technologies, and we are very happy, to have the opportunity to partner up with you to help us, in that transition as an organization.
And thanks for the partnership. And you both said that healthcare most probably is not the industry that is more advanced in terms of applying digital and data and technology to transform healthcare. So I'm curious where you get inspiration from. So thinking about driving the digital transformation of a hospital group, or moving the digital agenda and CSL V4 forward, where do you go for inspiration? Because most probably healthcare, it's not going to be your biggest inspiration sources for digital?
Yeah, I mean, I can start just to share a little bit. So the pharmaceutical industry is a heavy, as you probably know, regulated industry, and I would say the main reason, is that we need to deliver efficacious but also safe products, safe medicines to patients. No? And that has generated a bit of a lack in innovation in the pharmaceutical industry that I see now picking up as we speak. Now we think about innovation. Innovation, for example, for us, we think commercial excellence. Something that is changing is that we are not longer operating as a siloed organization. We are part of an ecosystem. And this ecosystem really includes, from academia to partners like yourself, other pharmaceutical companies and organizations. And from there, we are getting a lot of inspiration, let's say, to drive innovation. At the same time, we are a 30,000 employee company, and as you can imagine, we are also, generating own innovation in different areas of the globe that is then now being adopted at a global scale. At the same time, as I was alluding to, heavy regulated industry. So there is also, I would say, regulatory and compliance-induced innovation that we are living with these days. And just to give you an example, we as a pharmaceutical organization, we are not obliged, but it's a good practice to disclose the payments, we would make to healthcare professionals in our interactions with them, the so-called transfers of values. So we are working on a number of tools, also with the support of PA for All, to automate, the way we report those transfers values and the way this would go out, to investors and to anyone interested in understanding our commercial activities.
Cool.
I think it's actually, I was listening to you carefully, and the regulation is always a problem for us, of course, in healthcare. A problem, and at the same time, a safety place, we have to say it. But I would cut the innovation in healthcare into, one is actually healthcare, so the way we deliver all the care directly to the patient. And the other part is all the ecosystem around it, because we still have payments processing, we still have, of course, billings to manage, everything that is not directly related to the patient healthcare. In that sense, we actually can innovate kind of freely, except to the point that we need to take care of data, of course, because health data is a sensitive one. But nevertheless, on that part is quite similar to other businesses. But the culture from the companies normally, and probably you coming from Johnson & Johnson, which is, of course, innovative, but it's still in healthcare, it's different, right? It's a more conservative and more, let's say, careful, full approach to all the innovation. And in that sense, it's not that easy to implement, sometimes to go to the board, sometimes to make all the walking through along the system to make it happen. On the other hand, it's the professionals, the healthcare professionals are very open to innovation. Against what is normally sold all around, that we don't want to deal with technology and blah, blah. It's not true.
It's not true.
The thing is how the technology is implemented. How is it promoting the easiness to my daily basis or not? Yeah. And that's a moment that I think we are in time that probably in the next 5 years, let's say, it's going to change, which is technology is still playing, a technology meaning in the direct care, it's still playing a role that is not that good. We are still having to do the normal pathways that we've done before and the technological ones. In some parts. Other parts, it's, for instance, in ICUs, it's totally connected, and most of it is highly technological, highly efficient, and we know where is data every time in the second from whom it is and who is working. But exactly. It's just in small parts of the ecosystem. I think the challenge is going to be a true ecosystem, like a full one. We have small groups, small silos, a little bit like that, unfortunately. Yeah. I hate the word, but it's true. It's silos inside of the organization where technology is applied in a highly efficient and effective way, other ones that are super low and against technology, and then the ecosystem has to work as a whole. And that is the challenge. I think the next 5 years is going to be how can I connect all of them and make them actually synergetical, because if not, we are spending a lot of investment, doing a lot of investment that is not investment. It's just spending money in things that are not generating anything.
Absolutely.
So I think that's the tricky part. Regarding regulation, COVID actually did us a very good favor because it boosted telemedicine approach, all the regulation regarding medical councils all around the world. It's being reviewed. So some things that were stuck in time are actually moving now. So let's put energy on it so that it doesn't stop, I think.
I heard a lot in my previous role. I heard a lot about the regulatory challenges and how that prevent us from moving forward. One of the inspirations I got in the past was from different industries that were also very highly regulated, but significantly advanced in regard of healthcare. Either if it was the financial industry, and thinking about how regulated the financial industry is, but how much advanced is now digital in finance. And I don't remember the last time I went to a bank.
Exactly.
My bank is now my mobile phone, right? And you don't even think about bricks and walls anymore when it comes to banking and financial industry. But also aviation. Aviation is very, very highly regulated. But I got tremendous inspiration from the aviation industry and what they're doing over there in terms of digital twins, in terms of how they're looking at IoT, how they are looking into different areas of digital and technology, and try to bring those innovative thoughts into a more traditional industries such as healthcare. But you mentioned, go ahead.
No, it's very interesting, like you're referring the aviation part, because whenever we were thinking about two projects regarding awards, we actually were doing digital twinning and the approach regarding training like aviation. So we generated like a simulator that was based on the technology they were using, the approach they were using too, and then how can we do it for award so that doctors or young doctors can actually train in a real world approach, and then how can I put augmented reality in real world so that I can recall my mistakes and my improvements in a real patient so that I do not do it again.
That's fantastic.
I think that's aviation is a good one.
Absolutely. You both mentioned ecosystems, and you also mentioned COVID. And one of the things that really was good about COVID, there was not obviously everything wrong about COVID, but there was a couple of good things about COVID. One was the boost in digital transformation that everyone is facing right now. But the other thing, you mentioned ecosystems, and I saw the different stakeholders of healthcare all coming together. Either if it's the pharmaceutical companies, if it's the health providers, if it's the insurance companies, if it's the government, everyone came together in the ecosystem of healthcare to try to fight this pandemic together. But then the pandemic starts to fade away, and then we go back into our silos.
Business
and here in this panel, we have a pharmaceutical company, we have a hospital provider. How do you see these? Can we take advantage of the progress of collaboration that we had with COVID? And can this be sustainable over time? Or do you feel that we're going back to our silos now that the pandemic is over? Or kind of. I'm not sure if it's over.
Yeah. I mean, look, I think the collaboration between the pharmaceutical industry and the healthcare system, healthcare organizations like yours, is a topic of increased relevance. It is quite interesting because until COVID, pretty much, I think, the pharmaceutical industry was taking a look at healthcare institutions as a purely transactional partner. And this is now evolving, right? From a pharmaceutical industry standpoint, I can share a couple of examples that we have seen or what we have seen change for better, I would say. One is from a commercial standpoint. Actually, when COVID started, it was very hard for us as a pharmaceutical company to visit physicians. So I was alluding earlier, we are a pharmaceutical company, specialty pharmaceutical company. So for us, the interaction with specialists is fundamental, no? Especially nephrologists, cardiologists, and a few other specialists. So COVID made it very difficult for us to actually reach out, to physicians in some countries. In countries like the UK, for example, still today we have tremendous difficulties visiting, having face-to-face conversations with physicians. So that led, obviously, to a lot of innovation, new ways of engaging, with hospitals, with physicians. And I think that we have improved a lot on both sides, I would say, on the adoption of new technologies. At the same time, it's also worthwhile mentioning that not everything is that beautiful. I've been speaking, and we have a lot of meetings, as you can imagine, with physicians, and we need to acknowledge that there is also digital fatigue, because now physicians, they are receiving a lot of, invitations to webinars, a lot of newsletters, a lot of invitations to team calls. So I think it's also very important, for us as a pharmaceutical company, how do we orchestrate that? And this is where an orchestrated ecosystem around Omnichannel is that important, no? And this is one of the key initiatives for us in the team to really, orchestrate the communication to our customers in the best way possible. And something that I was alluding to at the beginning, also to embed the customer insights into that approach. So to really understand, what physicians want and need from us, so that we, in our interactions with them, we are providing them with the type of information, type of interaction that they would wish to have. So like I said, for us, really is an area, where I think there is a lot of evolution. I think in general, Omnichannel in the pharmaceutical industry is also an area, with a lot of potential. And coming back to the statement from J&J, probably we will see, a radical change again in the next 5 years, probably. The other area where we have seen a lot of improvement and collaboration, for example, is actually on the supply chain end. If you think about, the limitations on COVID, this generated new ways of engaging, between pharmaceutical companies and healthcare institutions. Think about the vaccines, for example. A managed stock of vaccines is very challenging, are usually cold chain products, and this has led to a lot of, development from a supply chain standpoint in terms of collaboration that I believe will remain in place. So all in all, I think, we are really switching from, as I was alluding to at the beginning, from being purely transactional partners, to a really more integrated ecosystem. No? But I think, there is still a lot of evolution in the next years that I believe we will see.
I totally agree with everything. I think just to add, there were three parts or three aspects that actually we felt a change during COVID, and I think that are good examples on how an ecosystem can be really an ecosystem and not just a group of people around. In the middle of COVID, and regarding supply chain, we are part, until now, of United Healthcare Group, which is a large group of healthcare in the world, and we have in different geographies, not only hospitals, but also insurance company and so on. So during COVID, there was a problem with almost everything in the supply chain, right? Like whenever it's related to healthcare. So, like care delivery. So we had this partnership between all geographies that previously was, no, it's impossible, we cannot share it, we cannot buy together, we cannot spread all the invoices and so on. No, we couldn't, because we couldn't regarding financial aspects, we couldn't regulatory aspects, and so on and so forth. So everything was impossible. And then in the middle of COVID, need was so strong that we just jump on it. And then we think about it. Exactly. And it was extremely efficient, and we never had a lack of anything. Neither gloves, masks, respiratories, nothing. Everything was in time, in the right place, which was something that actually showed the power of a group doing something together. And the thing is, even in large companies, many times we are part of a big company, just in the sense of CapEx, maybe sometimes, or in the sense of sharing some part of the knowledge. But data, information, decision-making processes are not different. So we are not receiving or taking the benefit of being part of a larger thing than us. So I think this was one lesson, and after COVID, everything got back to normal. We still exactly going back to how it was before. We still have groups that discuss digital transformation. We have other group that is discussing actually pharma, but it's just discussing. It's not actually doing action on it. And during COVID, we were. On the second part, that ecosystems actually changed in that sense is now we have a different perspective on how data is important. Because many times, and that might be ironic because healthcare is based on data, or ideally, all the healthcare decision in the care and also as a business would be data-oriented. But the thing is, in businesses where we do not have a problem about number of customers, about needs, because it's going to happen. Sometimes data is not aligned it's not our priority. Let's say like that. It's a priority in the decision-making process for doctors, for nurses, for our pharma department, but it's not as a whole. And with COVID, we understood that we had to have an amazing view on the supply chain, that we were losing money here, there, and as a whole group, not only in Portugal, I mean all the group. And that was an open eyes thing. I think some of the strategic alignment after COVID is much more aligned with my department than it was before. Meaning now I was screaming about data before and it was not that important, let's say like that, and now it's much more aligned. So it helped definitely a lot. Regarding relationships with other players from the sector, I think it improved in the moment where COVID was there, in the sense that we were much more connected, but then we did not build a strategy or a strategic plan. I'm going to go for the strategic plan, not a strategy, on how we want to have this relationship. Because there's a lot of regulatory issues, and it's not clear how data is supposed to be transacted. Should it be open? Should it not be? Should I, as a patient, be opt-in or opt-out? Should I need to say that I don't want to be part of the game or that I want to be part of it? So all of these, strategically, has European Union, let's say, or has North America, it's not defined. So sometimes we have very nice initiatives, but with a group of people that we cannot scale up or make it normal, let's say, because there's not a strategy. Like we are now talking about data lakes, about healthcare in the EU, but it's still going. So I think this relationship would be much easier if we have something saying, this you can share, this you cannot, for this you need a consent, for this you don't, and so on and so forth.
Cool. Let me switch gears a little bit into a little bit of ethical AI in healthcare, but also value-based contracting or outcome-driven healthcare. And everyone is speaking about outcomes-driven healthcare as the way to go. And I fully understand when you go to surgery, what you want is to restore your joys of life. You don't. It's not the episode of surgery, it's the episode of restoring health, right? But this, whilst it's really, really the future and I can see it coming, it also brings some challenges in terms of how do we use patient data in order to help outcomes-based medicine or value-based contracting. At the same time that patient data can also be a challenge in terms of equality, in terms of access, in terms of healthcare for everyone. So how do you see these, it's almost opposite challenges of once is we want to go into value-based contracting, we want to go outcomes-driven healthcare, but on the other hand, this personalized data, personal data on healthcare can go in your favor or can go against you when it comes to this topic. So what's your thoughts on that?
Yeah, so just for the benefit of the audience, because I don't know if the concepts are known or clear to everyone. When we take a look at what is happening across the healthcare systems in Europe, also in the US, usually among the most developed countries. Healthcare systems are under tremendous financial pressure. And there are a few elements that are leading to that pressure. One, and those may be very obvious to you, but just to put value-based healthcare a bit in the context of what is happening today in countries like Portugal, but also in Switzerland, where we are based. Population aging, people live much longer. We diagnose earlier, sooner, and better chronic diseases, so we need to treat patients, with chronic kidney disease, for example, diabetes, for a much longer time frame than it used to be done in the past. The expectations from all of us towards healthcare are increasing as well. So every one of us is expecting, better medicines, better services. If you go to hospital, as what we used to have probably 15, 20, 25 years ago. So there are numbers of elements that are increasing the healthcare costs of the systems quite heavily. And those costs are growing twice as high as the GDP growth in the most developed countries. So just to put this in context, as you can imagine, it's tremendous pressure that we are putting. On top of that, the way healthcare works today in most of the countries, it's pretty much a volume business. So basically, the healthcare system would need to pay, based upon the amount of visits to a physician, the amount of visits to an emergency setting, the amount of medicines that you get. So, and as you see, with these demographic changes, changes in the way we treat patients, and also the increase in population, it's becoming quite challenging for healthcare systems to absorb all of that. So the idea of value-based healthcare, as you were alluding to, Nuno, is to help both healthcare systems and also pharmaceutical companies to develop, the best ways of understanding, what is the clinical therapeutic value of an intervention, of a drug, and how do we pay a fair amount, for that intervention. Now, that being said, it looks simple on paper. It is very difficult to implement. And here is, I would say, is when the beauty comes a little bit, between the healthcare organization. We would have, the payers, is usually the Minister of Health in most European countries, and then the pharmaceutical companies. And I think the big challenge comes from, how do we develop systems that are allowing these three parties to talk to one another and agree on a common of standards when it comes to those values, that we are measuring against, that would lead then to payments at a later point in time. So it is a trendy topic, but still today very much underdeveloped, given the complexity and the difficulty to implement. What I have seen personally is that in my home country, in Spain, and that's quite interesting, is one of the very few countries where I have seen this initiative coming from a Ministry of Health, is the Ministry of Health of Spain have selected a portfolio of very expensive drugs, CAR-T drugs from a number of manufacturers, and they are, kind of piloting a system with those companies by which, those companies would upload the data of the products. The hospitals will upload the data on, how the patient, for example, is evolving. And the system, basically, what it does is it assesses the therapeutic value or effectiveness of the treatment, and determines, which is the fair price, if you will, that the healthcare system would need to pay to a pharmaceutical company. I think it's a topic, in my opinion, of need. It's not only a trendy topic, it's something that we would need to adopt in one way or another, because, like I said, the current situation for healthcare systems is really not sustainable. I see a lot of potential in here, but I think, this is really one of the topics, and I'm curious also to get your views, Sophia, where I really see that the partnership between healthcare and pharma is fundamental, and also where data will become a fundamental, data analytics, a fundamental enabler to value-based pricing and outcomes-based contracting.
It's very good. This question is amazing. Let me tell you, because it's really like in the touching 2 points. Like AI has an enabler or a problem. It can be in that system about value healthcare. So by by nature, I'm an optimist, and I think all doctors by training are realists, or slash pessimists. And and the thing is, I always think that we have tools that generate something good. We are just trying to figure out right now how that good can be done. And that's probably the challenge, I think, regarding when we think about ethical AI, because I'm very worried about discrimination and about manipulation, because we all know that even without having this objective, of course, like even having a good intention, it's quite easy to have this manipulation part. Because many times, and we can see it, I can see it at home, meaning like in United Healthcare, we have some geographies where we have a verticalization of the business. So we have the healthcare system fully. We have the hospitals, we have the insurance company, and sometimes we have the primary care too. So we have all the information about the patient from the beginning to the end, everything that he uses, how is it, how are the habits and everything. So if there is not a very clear strategy on the data, and also regulation on what should I do, what can I do, what should I do, I am going to underline that, not what can I do, what should I do, and what I cannot do, it's really hard to be clear on that, because it's easy to take a decision in the business based on healthcare, for instance, information. Because it's easy. Like I have the data of the patient, I can predict. Of course, if I anonymize and so on and so forth, it's still easy to manipulate, because then we jump on the other side. This is the example that was given was actually amazing and very well explained, and it's the good part of the thing. But imagine that I have a hospital. Let's go out of private sector, go to public sector. I have a hospital that over and over delivers worse outcomes comparing to another one that is similar in size, in the type of patients, everything. So it's good that I have all the data. But if I diminish the investment on that hospital, it's never going to be better. So it's better to close it already or to change the team, because if I invest less and less, it's always going to be worse.
Exactly.
And that just amplifies discrimination and the differences that we actually assist in the world. So that's one of the bad parts of value-based healthcare if it's not extremely well planned. And I don't think we are in a mature step yet to do it. On the other hand, if we do not do it, we're going to be navigating without the new systems, meaning it's like having a boat and I have all the technology to know where I want to go. No, I just want to see the stars. I'm fine. So it doesn't make sense as well. Yeah. But I think, again, strategy on this is crucial. It has to be groups of people from all the stakeholders engaged to decide what is the right path now. I say the right between commas because, of course, we don't know what's going to happen after. But if we go on this navigation without strategy, it's not going to work. So we are going to avoid very good solutions because we are afraid of them. And we are afraid of them because we didn't plan. So it's always the same loop. And I know that in the future, of course, because we are putting a lot of effort in prevention. And actually, Spain is a very good example on a different PPP, private-public partnerships, different from ours. So ours, we have a hospital that was built and owned by one entity, public entity, and then managed by a private entity. In Spain, they have, in some parts of Spain, actually, a full healthcare, everything about the healthcare of a population in a PPP. So they have everything they can handle. It's an ecosystem. They have the primary care, they have the hospital, they can generate intermediate steps, they can go on home care, for instance, they can decide whatever they want to do, which is really amazing, because this is probably the examples and like small pilots, let's say, on how value-based healthcare would play a very important game, because they have the full picture. You have X amount of million of euros, and now you have this number of people, take care of them. Yeah. And then you can measure what's happening in the long term, what's happening with chronic disease. Do I diagnose it earlier? Can I predict them? Can I reduce them? Because that would be the aim. And then now they are connecting with schools too. So they are teaching in schools, how can you take care? And this is this data is all moving around, which is probably one of the first places in the world doing that. So I think this
Really
is
nice.
a very good example on how a real ecosystem with no silos, based in value,
with data being
exactly
transferable across the value chain.
How can it work? So I think I'm very looking forward to see the outcomes in a long time, in the long range model.
Cool. We're running out of time. I want to really thank you on behalf of the people that are here, but also the 800 people that are watching us online. I don't think we referenced that, but tomorrow, this year, we had a record in attendance. 800 people registered for this event, and I'm sure everyone took a lot of value from this. Any final words from you in terms of how data in particular is transforming? And what would you expect for a collaboration with BI for All to help you to be even more successful?
I mean, you said it at the beginning, and you know, data is pretty much everywhere. The amount of data that we deal with as a pharmaceutical organization is increasing day by day, and so the complexity, but also the complexity of our business, the requirements from our leadership team, as I was alluding to, the requirements also from regulators. So I think we are really, and you know, in our collaboration with BA for All, you're really helping us, and for those of you who don't know, across three fundamental verticals for our business. One is to help us optimize and understand our performance by country, but also by product. It may sound very obvious, but trust me, in the pharmaceutical industry, once you go down to patient-level data, it becomes a very complex process to orchestrate. So that's one of the key areas where I see that we will be evolving together with BI for All. Next to that, something we have discussed today, omnichannel analytics, new ways of engaging you know, our different partners, including, of course, you know, our healthcare colleagues as well. So that's also, you know, an area of increased relevance where, you know, we believe that we can learn a lot from BI for All and your experience as well with other clients. And last but not least, if we take a look at OpEx for a pharma company, our customer-facing employees account for a big bunch of the costs that we have. You know, think about the MSLs, think about the reps, think about the key account managers, and so on and so forth. So the last pillar, and also of strategic relevance for us, also from a data standpoint, is how do we maximize the interactions of our commercial organization or medical organization, you know, with their ecosystems. How do we understand those interactions, and how do we understand where we should interact more, where we should interact in a different way, and how can we drive some fundamental aspects of our business today, like, for example, like differentiation is becoming also increasingly important as well. So I think around those three pillars is what I see the collaboration, you know, between CSL and VI for All going forward in the next few years. But I would assume, you know, that we'll likely expand into other areas, and like I said, I'm very much looking forward to the collaboration with.
Thank you for the partnership
with VI for All.
Sophia?
So in our case,
your last words to the audience.
Oh my God.
So we can close it. We can
Sure.
close it.
So I'm going to be short. In the last 2 years, we've been building a lot of specific solutions for the users, meaning for the patients and, let's say, for the citizens, because we also have a lot of healthy people that are actually just avoiding to be a patient. So we created the Omnichannel, we created some other supporting systems like the health line and so on, so that we have an ecosystem, right? A fully functional ecosystem. So now we have data going everywhere in the ecosystem, navigating everywhere. And I think it would be very interesting to be able to, instead of having CRMs that are like the standard CRMs and so on, to have it connected to our business intelligence too, so that we can deep dive to the patient and do the zoom out to the organization. So we have a lot of data going there around. We are not using predictive capacity in almost anything regarding organization. We are using it in clinical field, but not there. We are not managing fully how we can handle capacity between units and so on. we are not doing a deep dive on knowing how to cluster our patients, for instance. So there's a lot of information going there that actually could be used and should be used in that sense, because we would reduce everything that burdens the system and to reduce the total cost of care. Because on the other, it's not obvious, I think, sometimes to the outside of the system, but the aim of healthcare providers as general is volume. So we would prefer to reduce total cost of care in many fields, like, for instance, ERs, in exams and everything, so that we can reach more people. So that data would be very interesting to apply like that. So I think it's probably the one macro field where we can actually partner. So
fantastic. Well, let me thank you. And Nicholas, Sophia,
thank you.
So great to have you on the panel. And let's partnership together.
Absolutely.
Thank you very much.
Thank you.